This is joint-to-joint movement. We start off with protracting and retracting the neck. We move into flexion and extension of the neck. We then move into lateral bending of the neck. We then move into circles of the neck or rotation. And we go the other way, starting small. We move into lateral deviation of the neck. And then into shoulder rolls. Moving forward first, and then backwards. We move to the glenohumeral joint in the shoulders and start with low shoulder rotations. And then high shoulder rotations. Moving from smaller to bigger. And then we start with parallel shoulder rotations. We move to the elbows. And on to the wrists. Taking the wrists through flexion and extension with the forearms up and forearms down. We move into wrist circles. Ulnar and radial deviation of the wrists. Finger flexion and extension. And finger rotation. And finally, for the upper limb, thumbs. Rotation forwards and backwards. And then flexion. And extension. For the spine, we work first on our standing cat camels. And our full extension. We move on to our pelvic tilts, focusing just on moving the pelvis. For our lower body, we have our dowel, and we start off with our hip flexion and extension. Activating the glutes and bringing the hip back. We then move into our hip rotation, moving from smaller to bigger circles, using the entire range of that ball and socket joint in the hip. Move to the left side for the hip joint. Slowly getting bigger, using all of that joint to maintain its range of motion. We go on to the knee, bending and extending the knee as far as it will go. And on the left, we go into knee rotation, getting what little rotation we can out of the knee, rotating it back and forth. We then go to the ankle, flexing and extending it, and then bringing it sideways, in and out, and then finally the toes. We add a small dynamic component to the hips for flexion extension. Nice, easy leg swings, maintaining balance with the dowel. And then forwards and backwards. Side to side. That's joint by joint movement. That's something that we're going to want to include every single day as part of our corrective exercises and our corrective care program to make sure that your joints stay healthy and your body is correcting that pattern.